Good morning, everyone. This is me, Dr. Zahrani from King Saud University. Today, I'm happy to talk about my research. My research is testing an etiological model of social phobia studied in the Kingdom of Saudi Arabia. Social phobia is one of the most psychiatric disorders with lifetime prevalence rate as high as 13%. And some scholars found that 69% of all people with social phobia reported impairment in the general social relationships and work performance. Social phobia results in significant disruption to a person's life and is a distressing and anxiety disorder. The etiology of social phobia remains poorly understood despite the reality of relatively high prevalence rates. A little attention has been paid to researching the etiology of social phobia. The aim of current study was to test an etiological model of social phobia in the Kingdom of Saudi Arabia based on existing literature, several variables such as behavior inhibition, neuroticism, parental rejection, fear of negative evaluation, and victimization were selected for a model of social phobia for inclusion in a model which was tested. To my knowledge, no studies had examined an etiological model of social phobia in the Kingdom of Saudi Arabia. The hypothesis of the current study divided into 5 main hypotheses. First, fear of negative evaluation would be proportionately affected by behavior inhibition, neuroticism, and parental rejection. Victimization would be proportionately affected by behavior inhibition, neuroticism, and rejection. Psychological phobia would be proportionately affected by fear of negative evaluation and victimization. Physical phobia would be proportionately affected by fear of negative evaluation and victimization. The last hypothesis was social phobia would be proportionately affected by fear of negative evaluation and victimization. A total of 240 Saudi participants, men 120 and women 120, were included in the current study. All participants were between 18 and 40 years of age, and all of them were selected randomly from outpatient clinics. All participants were seeking treatment for a range of general medical and psychiatric conditions, depression and anxiety. And so there were 2 main sources of which referred participants to the study. First, individuals who were suffering from high anxiety and depression were referred by psychiatrists at psychiatric department at the Ministry of Mental Health Hospital in different cities, Riyadh, Taif, Jeddah, Mecca, and Medina. The second sources was individuals who sought treatment for general medical condition were referred by outpatient physicians from the same hospitals. The result of the current study indicated that behavior inhibition, neuroticism, parental rejection didn't have a direct path to social phobia except behavior inhibition, which had a direct link to physical phobia. But they were mediated by 2 causal variables. The first mediator was fear of negative evaluation, which had a direct link to social phobia and was influenced by one of antecedent variables, which called neuroticism. The second mediator was victimization, which had a direct link to social phobia via behavior inhibition and parental rejection. Fear of negative evaluation and victimization appear to play a significant role in the development of social phobia, commencing in early life during childhood and developing in later life. In conclusion, this study represents one of the first to test an etiological model of social phobia within a non-Western culture. Evidence was found that for partial and full mediating effects of cognitive construct, for example, fear of negative evaluation, and an environmental factor victimization in the development of social phobia. The model confirmed that, in addition to generalized vulnerabilities, behavior inhibition, neuroticism, parental rejection, these two additional variables are specific to the development of social phobia. This suggests that the development of social phobia may share universal construct across cultures. The current results strongly suggest that the importance of early intervention to target the specific risk factors of fear of negative evaluation and victimization in children identified as at risk due to elevated levels of neuroticism, behavior inhibition, and parental rejection. Parent and clinical therapists should work together to find solutions earlier, starting first from the family environment and continuing with schooling, where interventions to enhance self-image and promote optimism among school children are made part of the normal curriculum. Thank you for your attention.